Hello everyone, now let us discuss about CPT coding guidelines for radiology. In the current session, we will be focusing on Diagnostic Radiology Part 1. So whenever we are assigning a CPT for Diagnostic Radiology, there are two considerations that we need to look after. The first is anatomical region or name of the particular bone, and the second is type of technique performed. Based on these two are the key terms that we must look for while assigning a code for diagnostic radiology. Now coming to diagnostic radiology. The diagnostic radiology is broadly categorized into four types. The first one is radiological examination, which are nothing but X-rays. Next is computed tomography or CT. Next is magnetic resonance imaging or MRI, and finally magnetic resonance angiography MRA. So whenever we code X-rays, the first point that must be taken into consideration is views, number of views. Before assigning a CPT for X-rays, we must consider number of views. And before assigning a specified CPT for CT or MRI or MRA, we must look whether it is with contrast or without contrast followed by contrast. For assigning CT or MRI or MRA, we must consider whether a contrast dye is administered or not. So before going into CPTs, as we have discussed earlier, whenever we are coding for X-rays, the primary point of consideration is number of views. The codes are categorized based on number of views. So the view may be anterior or posterior or lateral. So in order for better understanding, let us first discuss some of the directional terms or the anatomical terms in order to brush up. The directional terms, they describe the position of one body part relative to another, and several directional terms are grouped in terms and have opposite meaning. So first let us discuss about superior. What is superior? The definition is towards the head or upper part of the structure. So whenever we refer something as superior, it indicates that it is towards the head or it is upper part of a particular structure. For example, heart is superior to liver. That is, heart is towards the head when you consider that is relative to liver. The next term is inferior or quadrant, away from the head or lower part of a structure. For example, stomach is inferior to lungs. The next is anterior or ventral, nearer to or at the front of the body. For example, sternum is anterior to heart. Next is posterior, nearer to or at the back of the body. For example, esophagus is posterior to trachea. Now the next term is medial, nearer to the midline. For example, ulna is medial to radius. The next is lateral, farther from the midline. The lungs are lateral to the heart. This is an example. Next is intermediate, that is between two structures. For example, transverse colon is intermediate between the ascending and the descending colon. Now coming to ipsilateral. Ipsilateral is nothing but on the same side of the body as the another structure. For example, gallbladder and ascending colon are ipsilateral to each other. The next term is contralateral, on the opposite. Contra means opposite. So on the opposite side of the body from one another. The ascending and descending colons are contralateral to each other. The next term is proximal, which is nothing but nearer to the attachment of limb to the trunk or nearer to origination of a structure. For example, humerus is proximal to radius. The next term is distal, farther from the attachment of a limb to the trunk, farther from the origination of a structure. For example, phalanges are distal to the carpals. Phalanges are nothing but finger bones and carpals are nothing but wrist bones. The next term is superficial, towards or on the surface of the body. For example, ribs are superficial to lungs. The next is deep, that is away from the surface of the body. Ribs are deep to skin of chest and back are some of the examples. Now coming to planes that divide our body. Planes are imaginary flat surfaces that pass through the body parts. Now let us discuss about various planes. The first plane is sagittal plane, which divides body into right and left. Sagittal plane divides body into right and left. The next is frontal or coronal plane. It divides body into anterior and posterior portions. Frontal or coronal plane divides body into anterior and posterior portions. Next is transverse plane or cross-sectional or horizontal plane. It divides the body into superior and inferior portions. The next is oblique plane. It passes through the body at an obtuse angle, hence the name oblique. The sagittal plane has further subcategorization. Midsagittal or medial plane. It divides body into equal right and left side. Midsagittal or medial plane. It divides body into equal right and left. Next, parasagittal plane. Unequal left and right side. Sagittal plane divides body into right and left. Midsagittal or medial plane divides body into equal right and left sides, whereas parasagittal plane divides into unequal left and right sides. These are some of the planes. Now coming to diagnostic radiology and what are the topics that we are going to discuss in this particular session. So the various topics of diagnostic radiology are head and neck, chest, spine and pelvis, upper extremities, lower extremities, abdomen, gastrointestinal tract, urinary tract, heart, vascular procedures and other procedures. In this session, we will be discussing till the urinary tract, from head and neck to urinary tract. Now coming to radiological examination or X-rays. As we have discussed earlier, the CPT assignments are based on number of views. Anterior view, anterior X-ray or anterior view is considered as one view, posterior is considered as one view, lateral is considered as one view. Anterior posterior AP is also considered as one view. Posterior anterior is also considered as one view, whereas anterior and posterior or lateral and posterior, they are considered as two views. Antero-posterior is a single term and it is considered as one view. Similarly, posterior-anterior is considered as a single term and it is considered as one view. Let us see an example. A patient arrives at the urgent care facility with a swollen ankle. Anterior-posterior and lateral view X-rays of the ankle are taken. Here anterior-posterior is taken as one view and lateral is taken as another view. So total two views are done. So what is the CPT that we need to report? The answer is 73600, which is nothing but radiological examination ankle two views. Now coming to the CPTs of diagnostic radiology head and neck. The first CPT is 70010. It deals with myelography, posterior fossa, radiological supervision and interpretation. Myelography is nothing but diagnostic imaging of spinal canal. The next CPT is 70015. It deals with cysternography, positive contrast, radiological supervision and interpretation. Cysternography is nothing but diagnostic imaging of cerebrospinal fluid. Cisterns are the openings in subarachnoid spaces of the brain that are filled with cerebrospinal fluid. The next CPT is 70030. It deals with radiological examination I for detection of foreign body. 70030 deals with radiological examination I for detection of foreign body. The next CPT is 70100. Radiological examination mandible partial less than 4 views. The next CPT is 70110. It deals with radiological examination mandible complete minimum of 4 views. The next CPT is 70120. It deals with radiological examination mastoids less than 3 views per side. The next is 70130. It deals with radiological examination of mastoids complete minimum of 3 views per side. The next is 70134. It deals with radiological examination internal auditory meaty complete. Now coming to next CPT, that is 70140. It deals with radiological examination facial bones less than 3 views. The next is 70150. It deals with radiological examination facial bones complete minimum of 3 views. The next is 70160. It deals with radiological examination nasal bones complete minimum of 3 views. The next is 70170. It deals with dacrocystography, nasolacrimal duct, radiological supervision and interpretation. Dacrocyst is nothing but tear sac. Dacrocystography is diagnostic test for imaging lacrimal apparatus. The next CPT is 70190. It deals with radiological examination optic foramina. The next is 70200. It deals with radiological examination optic foramina orbits complete minimum of 4 views. The next is 70210. It deals with radiological examination sinuses paranasal less than 3 views. The next is 70220. It deals with radiological examination sinuses paranasal complete minimum of 3 views. The next CPT is 70240. It deals with radiological examination sella turcica. The next is 70250. It deals with radiological examination skull less than 4 views. Whereas 70260, it deals with radiological examination skull complete minimum of 4 views. The next is 70300. It deals with radiological examination teeth single view. The next is 70310. Radiological examination of teeth partial examination less than full mouth. The next is 70320. Radiological examination teeth complete full mouth. The next is 70328. It deals with radiological examination temporomandibular joint open and closed mouth unilateral. The next is 70330. It deals with radiological examination temporomandibular joint open and closed mouth bilateral. The next is 70332. It deals with temporomandibular joint orthography, radiological examination and interpretation. The next is 70336. Magnetic resonance. Example proton imaging. Magnetic resonance imaging temporomandibular joint. MRI of temporomandibular joint is given by 70336. The next is 70350. That is nothing but cephalogram orthodontic. Cephalogram is nothing but a lateral X-ray of skull and soft tissues used to assess the relationship between teeth and jaws, jaws to skull and teeth and jaws to soft tissues. The next is 70355. It deals with orthopantogram, which is a wide view X-ray of lower face which displays all teeth of upper and lower jaws in one film or one view. Now coming to next CPT 70360. Radiological examination neck soft tissue. The next is 70370. Radiological examination, pharynx or larynx, including fluoroscopy and or magnification technique. The next is 70371, complex dynamic pharyngeal and speech evaluation by sign or video recording. The next is 70380, radiological examination of salivary gland for calculus. The next CPT is 70390, xylography, radiological supervision and interpretation. Xylogram is nothing but X-ray of salivary gland and ducts. Next is 70450, computed tomography, head and brain without contrast. 70460 is CT, head and brain with contrast. 70470 is CT, head and brain without contrast, followed by contrast material and further sequences or sections. The next is 70480, CT, orbit cella or posterior fossa of middle, outer, middle and inner ear without contrast. 70481 is CT, orbit cella or posterior fossa or outer, middle or inner ear with contrast. Whereas 70482 is without contrast, followed by contrast material and further session. The next is 70486, computed tomography, maxillofacial area without contrast material. CT, maxillofacial area. The next is 70487, CT, maxillofacial area with contrast. Next is 70488, without contrast material by contrast, followed by contrast and further sessions. The next is 70490, CT, soft tissue neck without contrast. 70491 is CT, soft tissue neck with contrast. The next is 70492, which is nothing but CT, soft tissue neck without contrast, followed by contrast material and further session. The next is 70496, CT, tomographic angiography, CTA, head with contrast, including non-contrast images if performed and image processing. 70498 is nothing but CT, angiography, neck with contrast, including non-contrast images if performed and image processing. Next is 70540, magnetic resonance imaging, orbit, face and or neck without contrast material. 70542 is the next CPT, which is nothing but MRI, orbit, face and or neck with contrast material. Whereas 70543 is nothing but MRI, orbit, face and or neck without contrast, followed by contrast material and further sequencing. And the next is 70544, which is nothing but magnetic resonance angiography, MRA, of head without contrast material. And the next is 70545, which is nothing but MRA, magnetic resonance angiography, head with contrast. 70546 is nothing but MRA of head without contrast, followed by contrast material and further sequences. The next CPT is 70547, which is nothing but MRA, neck without contrast material. 70548 is MRA, neck with contrast material. 70549 is nothing but MRA, neck without contrast, followed by contrast material and further sequencing. The next is 70551, which is nothing but magnetic resonance imaging, orbit, face and or neck without contrast material. Next is 70552, which is nothing but MRI, orbit, face or neck with contrast. Next is 70553, which is nothing but MRI, orbit, face or neck without contrast, followed by contrast material and further sequences. The next is 70554, MRI, brain, functional MRI, include test selection and administration of repetitive body movements and or visual stimulation, not requiring physician or psychologist administration. MRI, brain, functional MRI. 70554 is nothing but functional MRI of brain. The next is 70555. This is also MRI brain, functional MRI. Include test selection and administration of repetitive body movements and or visualization, requiring physician or psychologist administration of entire neurofunctional testing. Now let us look at an example. A patient reports to hospital radiology department for a functional MRI of the brain. Technician asks the patient to perform small tasks. He takes images of the patient at rest and while performing the task. What CPT code is reported? This is a functional MRI and here physician or psychologist is not present. The technician is asking the patient to perform small tasks. So the appropriate CPT is 70554. Magnetic resonance imaging brain functional MRI including test selection and administration of repetitive body part movements and or visual stimulation not requiring physician or psychologist administration. Now coming to next CPT, that is 70557, which is nothing but magnetic resonance imaging brain during open intracranial procedure without contrast material. 70558 is nothing but magnetic resonance imaging MRI brain during open intracranial procedure with contrast material. 70559 is nothing but MRI brain during open intracranial procedure without contrast followed by contrast and further sequences. Now coming to the diagnostic radiology codes for chest. The first CPT is 71045, which is nothing but radiological evaluation or examination chest single view. 71046 is nothing but X-ray chest 2 views. 71047 is X-ray chest 3 views. 71048 is 4 views, 4 or more views. The next is 71100. Radiological examination ribs unilateral 2 views. Next 71101. Radiological examination ribs unilateral including posterior anterior chest minimum of 3 views. Next 7110 is radiological examination ribs bilateral 3 views. The next is 71111. Radiological examination ribs bilateral including posterior anterior chest minimum of 4 views. The next is 71120. Radiological examination sternum minimum of 2 views. The next is 71130. Sternoclavicular joint or joints minimum of 3 views. Next is 71250. CT thorax diagnostic without contrast material. CT thorax diagnostic without contrast material. The next is 71260. CT thorax diagnostic with contrast. Now coming to next CPT 71270, which is nothing but CT thorax without contrast followed by contrast material and further sequences. The next is 71271. Computed tomography thorax low dose for lung cancer screening without contrast material. The next is 71275. Computed tomographic angiography CTA chest with contrast material including non-contrast images if performed and image post-processing. The next is 71550. Magnetic resonance MRI magnetic resonance imaging chest without contrast material. The next is 71551. MRI chest with contrast. 71552 is nothing but MRI chest without contrast followed by contrast material and further sequencing. Next 71559. Magnetic resonance angiography chest without or without contrast material. MRA of chest with or without contrast material. Now let us discuss one more example. A patient was admitted to observation status after losing control and crashing his motorcycle into his guardrail on the highway. A CT scan of brain without contrast and chest is performed. CT of chest and brain is performed. 3 views of right and left side of rib cage reveal fractures of left third and fifth rib. What are the appropriate CPTs for this scenario? The first is CT scan of brain without contrast. That is 70450. Computed tomography head and brain without contrast material. Next, CT of chest is also performed. Chest is nothing but thorax. 71250. Computed tomography thorax diagnostic without contrast material. The next is X-ray of ribs bilateral right and left. 3 views of right and left rib cage. That is bilateral radiological examination of ribs 3 views. The CPT is 7110. 26 modifier is appended to all CPTs to append the professional component. Now coming to diagnostic radiology, CPTs for spine and pelvis. The first CPT is 72020. Radiological examination spine single view specified level. The next is 72040. Radiological examination spine cervical 2 or 3 views. 72050 is nothing but radiological examination spine cervical 4 or 5 views. 72052 is nothing but radiological examination spine cervical 6 or more views. Now coming to 72070, which is nothing but radiological examination spine thoracic 2 views. 72072 is nothing but thoracic 3 views. 72074 is nothing but thoracic minimum of 4 views. 72080 is thoracolumbar junction minimum of 2 views. The next is 72081. Radiological examination spine entire thoracic and lumbar including skull, cervical and sacral spine if performed. For example, scoliosis evaluation 1 view. Similarly, 72082 is nothing but radiological examination spine entire thoracic and lumbar including skull, cervical and sacral if performed 2 or 3 views. 72083 is nothing but 4 or 5 views and 72084 indicates minimum of 6 views. The next CPT is 72100, which is nothing but radiological examination lumbosacral 2 or 3 views. 72110 is nothing but radiological examination spine lumbosacral minimum of 4 views. 72114 indicates radiological examination spine lumbosacral complete including bending views minimum of 6 views. The next is 72120 radiological examination spine lumbosacral bending views only 2 or 3 views. Now coming to next CPT 72125, which is nothing but CT cervical spine without contrast material. 72126 is CT cervical spine with contrast material. 72127 is nothing but CT cervical spine without contrast followed by contrast material and further sequences. Next is 72128 CT thoracic spine without contrast material. 72129 is CT thoracic spine with contrast material. The next is 72130 CT thoracic spine without contrast material followed by contrast material and further sequences. The next is 72131 CT lumbar spine without contrast. 72132 is CT lumbar spine with contrast. 72133 is nothing but CT lumbar spine without contrast material followed by contrast material and further sequences. The next CPT is 72141 magnetic resonance imaging, spinal canal and contents, cervical without contrast material. The next is 72142, magnetic resonance imaging, MRI, spinal canal and contents, cervical with contrast material. The next is 72146, magnetic resonance imaging, spinal canal and contents, thoracic without contrast. The next CPT is 72147, which is nothing but magnetic resonance imaging, spinal canal and contents, thoracic with contrast material. The next is 72148, magnetic resonance imaging, spinal canal and contents, lumbar without contrast. 72149 is MRI, spinal canal and contents, lumbar with contrast. 72156 is nothing but magnetic resonance imaging, spinal canal and content without contrast material, followed by contrast material and further sequences. 72156 is nothing but MRI, spinal canal and contents without contrast material, followed by contrast material for further sequences, cervical. The next CPT is 72157, which is nothing but MRI, spinal canal and contents without contrast material, followed by contrast material and further sequences, thoracic region. Whereas 72158 is MRI, spinal canal and contents without contrast, followed by contrast material and further sequences, lumbar region. The next is 72159. Which is nothing but magnetic resonance angiography, spinal canal and contents with or without contrast material. MRA of spinal canal and contents. The next is 72170, which is nothing but radiological examination, pelvis, 1 or 2 views. The next is 72190, radiological examination, pelvis, complete, minimum of 3 views. The next is 72191, CTA, pelvis with contrast, including non-contrast images if performed and image post-processing. The next is 72192, CT, pelvis without contrast material. The next is 72193, which is nothing but CT, pelvis with contrast material. The next is 72194, CT, pelvis without contrast material, followed by contrast material and further sessions. The next is 72195, MRI, pelvis without contrast. The next is 72196, MRI, pelvis with contrast. The next is 72197, MRI, pelvis without contrast material, followed by contrast material and further sequences. The next code is 72198, which is nothing but MRA, pelvis without or with contrast material. The next is 72200, radiological examination, sacroiliac joints less than 3 views. The next is 72202, radiological examination, sacroiliac joints, 3 or more views. The next is 73220, radiological examination, sacrum and cox, minimum of 2 views. The next is 72240, which is nothing but myelography, cervical, radiological supervision and interpretation. The next is 72255, myelography, thoracic, radiological supervision and interpretation. 72265 is nothing but myelography, lumbosacral, radiological supervision and interpretation. Next, 72270 is nothing but myelography, 2 or more regions, radiological supervision and interpretation. The next is 72285, discography, cervical or thoracic, radiological supervision and interpretation. The next is 72295, discography, lumbar, radiological supervision and interpretation. Now let us discuss an example. A patient needing scoliosis measurement is coming to have standing, anterior, posterior and lateral views of his entire thoracic and lumbar spine. What CPT codes are to be reported? entire thoracic and lumbar spine, anterior, posterior and lateral views. That is, 2 views are taken for entire thoracic and lumbar spine. And the assessment is done to measure the scoliosis. So the appropriate CPT is 72082. Radiological examination spine, entire thoracic and lumbar, including skull, cervical and sacral spine if performed. For example, scoliosis evaluation, 2 or 3 views. Now coming to diagnostic radiology CPTs for upper extremity. The first CPT is 73000, which is nothing but radiological examination clavicle complete. The next is 73010, radiological examination scapula incomplete. The next is 73020, radiological examination shoulder 1 view. 73030 is nothing but radiological examination shoulder complete, minimum of 2 views. The next is 73040, radiological examination shoulder, orthography, radiological supervision and interpretation. The next is 73050, radiological examination acromoclavicular joints, bilateral with or without weighted distraction. The next is 73060, radiological examination humerus, minimum of 2 views. The next is 73070, radiological examination elbow, 2 views. The next is 73080, radiological examination elbow complete, minimum of 3 views. The next is 73085, radiological examination elbow, orthography, radiological supervision and interpretation. The next is 73090, which is nothing but radiological examination forearm, 2 views. The next is 73092, radiological examination upper extremity infant, minimum of 2 views. The next is 73100, radiological examination wrist, 2 views. The next is 73110, which is nothing but radiological examination complete, minimum of 3 views. The next is 73115, radiological examination wrist, orthography, radiological supervision and interpretation. The next is 73120, radiological examination hand, 2 views. The next is 73130, radiological examination hand, minimum of 3 views. The next is 73140, radiological examination finger, minimum of 2 views. The next is 73200, CT upper extremity without contrast. 73201 is CT upper extremity with contrast. 73202 is CT upper extremity with without contrast followed by contrast and further sessions. The next is 73206, CTA upper extremity with contrast including non-contrast images if performed and image post-processing. The next is 73218, MRI upper extremity other than joint without contrast material. The next is 73219, MRI upper extremity other than joint with contrast. The next is 73220, MRI upper extremity other than joint without contrast followed by contrast and further sequences. The next is 73221, which is nothing but MRI any joint of upper extremity without contrast. The next is 73222, MRI any joint of upper extremity with contrast. The next is 73223, MRI any joint of upper extremity without contrast followed by contrast material and further sequence. Now final code is 73225, MRI angiography upper extremity without or with contrast material. Let us see an example. 38-year male seen in the emergency department sustained an injury several hours ago to his left hand. when he fell and a team member stepped on it when playing tackle football. X-ray was taken in lateral, external, oblique and PA position. That is, 3 views are taken for left hand. The appropriate CPT is 73130. Radiological examination hand, minimum of 3 views. Now coming to diagnostic radiology CPTs for lower extremities. The first CPT is 73501, which is nothing but radiological examination hip unilateral with pelvis when performed 1 view. The next is 73502, radiological examination hip unilateral 2 to 3 views. The next is 73503, radiological examination hip unilateral with pelvis when performed, minimum of 3 views. The next is 73521, radiological examination hips bilateral with pelvis when performed 2 views. The next CPT is 73522, which is nothing but radiological examination hips bilateral with pelvis when performed 3 to 4 views. The next is 73523, which is nothing but radiological examination hips bilateral with pelvis when performed, minimum of 5 views. The next is 73525, which is nothing but radiological examination hip orthography, radiological supervision and interpretation. The next is 73551, radiological examination femur 1 view. The next is 73552, radiological examination femur minimum of 2 views. The next is 73560, which is nothing but radiological examination knee 1 or 2 views. The next is 73562, radiological examination knee 3 views. The next is 73564, radiological examination knee complete 4 or more views. The next is 73565, radiological examination both knees standing anterior posterior. The next is 73580, radiological examination knee orthography, radiological supervision and interpretation. The next is 73590, which is nothing but radiological examination tibia and fibula 2 views. The next is 73592, which is nothing but lower extremity radiological examination lower extremity infant minimum of 2 views. Lower extremity examination of tibia and fibula infant minimum of 2 views. The next is 73600, radiological examination ankle 2 views. The next is 73610, radiological examination ankle minimum of 3 views, complete. Next is 73615, radiological examination ankle orthography, radiological supervision and interpretation. The next is 73620, radiological examination foot 2 views. The next is 73630, radiological examination foot complete minimum of 3 views. The next is 73650, which is nothing but radiological examination calcaneus minimum of 2 views. The next is 73660, radiological examination calcaneus or toe minimum of 2 views. The next is 73700, CT lower extremity without contrast material. The next is 73701, CT lower extremity with contrast. 73702 is CT lower extremity without contrast followed by contrast material and further session. The next is 73706, CTA lower extremity without contrast material including non-contrast images when performed and image post-processing. The next is 73718, magnetic resonance imaging MRI lower extremity other than joint without contrast. The next is 73719, MRI lower extremity other than joint with contrast. The next is 73720, MRI lower extremity other than joint without contrast followed by contrast material and further sequence. The next is 73721. MRI, any joint of lower extremity without contrast. 73722 is nothing but MRI, any joint of lower extremity with contrast. 73723 is nothing but MRI, lower extremity, any joint without contrast material followed by contrast material and further sequences. The next is 73725. MRA angiography lower extremity, MRA of lower extremity with or without contrast. Now let us discuss some examples. A patient arrives at urgent care facility with swollen ankle. Anterior, posterior and lateral x-rays, 2 views of ankle are taken to determine whether the patient has fractured ankle. What CPT is to be reported? Here ankle 2 views are taken. So the appropriate CPT is 73600. Radiological examination ankle 2 views. Let us discuss one more example. A patient arrived at the hospital unable to stand on his leg after collision in soccer game. The patient's shin is sore to touch. 2 view x-rays of tibia and fibula are taken. What is the CPT? Reported by radiologist for x-rays. The CPT is 73590, which is nothing but radiological examination, tibia and fibula, 2 views. 26 modifier is appended to indicate professional component because radiologist is the question of interest here. Now coming to diagnostic radiology CPTs for abdomen. The first CPT is 74018, which is nothing but radiological examination abdomen 1 view. Whereas 019 is radiological examination abdomen 2 views. 021 is nothing but x-ray abdomen 2, 3 or more views. The next is 74022. Radiological examination complete acute abdomen series including 2 or more views of abdomen and a single view of chest. The next is 74150. CT abdomen without contrast. 74160 is CT abdomen with contrast. 74170 is CT abdomen without contrast followed by contrast material and further sessions. 74174 is nothing but CTA of abdomen and pelvis with contrast including non-contrast images if performed and image post-processing. The next is 74175, which is nothing but computed tomographic angiography CTA of abdomen with contrast material including non-contrast images if performed and image post-processing. The next is 74176, CT abdomen and pelvis without contrast. The next is 74177, CT abdomen and pelvis with contrast. 74178 is nothing but CT abdomen and pelvis without contrast in one or both body region followed by contrast and further session in one or both body regions. The next is 74181, which is nothing but magnetic resonance imaging abdomen without contrast. MRI with contrast for abdomen is 74182. Whereas 74183 is nothing but MRI abdomen without contrast followed by contrast material and further sequences. 74185 is nothing but MRA abdomen without or with contrast material. Magnetic resonance angiography of abdomen with or without contrast materials is given by the CPT 74185. Now coming to the final code 74190, which is nothing but peritoneogram, radiological supervision and interpretation. Now coming to the diagnostic radiology CPTs for gastrointestinal tract. The first CPT is 74210, which is nothing but radiological examination pharynx and or cervical esophagus including scot neck radiograph and delayed images when performed, contrast study. The next is 74220, which is nothing but Radiological examination, esophagus, including scout chest radiograph and delayed images when performed, single contrast study. The next is 74221, which is nothing but radiological examination, esophagus, including scout chest radiograph and delayed images when performed, double contrast, that is high density barium and effervescent agent study. The next is 74230, which is nothing but radiological examination, swallowing function and cineradiography or video radiography, including Scott neck radiograph and delayed images when performed, contrast study. The next is 74235, which is nothing but removal of foreign body, esophagus with use of balloon catheter, radiological supervision and interpretation. The next is 74240, radiological examination, upper gastrointestinal tract, including Scott abdominal radiograph and delayed image when performed, single contrast study. Upper gastrointestinal tract is given by 74240. Whereas 74246 is given by, indicates radiological examination, upper gastrointestinal tract, double contrast study, that is nothing but high density barium and effervescent agent, including glucagon when administered. The next is an add-on code plus 74248, which is nothing but radiologic small intestine follow-through study, include multiple serial images. The next CPT is 74250, which is nothing but radiological examination, small intestine, including multiple serial images and Scott abdominal radiograph when performed, single contrast study. Whereas 74251 indicates X-ray of small intestine, double contrast study, including glucagon when administered. The next is 74261, which is nothing but CT colonography diagnostic, including image post-processing without contrast material. CT colonography is given by 74261. 74262 is nothing but CT colonography with contrast, including non-contrast images if performed. The next CPT is 74263, which is nothing but CT colonography screening, including image post-processing. The next is 74270, which is nothing but radiological examination colon, including scout, abdominal and delayed images when performed, single contrast study. Whereas 74280 is double contrast study, including glucagon when administered. Next is 74283, which is nothing but therapeutic enema, contrast or air for reduction of intussusception or other intraruminal obstruction. The next is 74290, which is nothing but cholecystography, oral contrast. Cholecystogram is X-ray to evaluate gallbladder. Cholangiogram is X-ray of bile ducts. The next CPT is 74300, which is nothing but cholangiography and or pancreatography, intraoperative radiological supervision and interpretation. The next is an add-on code plus 74301, which is nothing but cholangiography or pancreatography, intraoperative, additional set intraoperative radiological supervision and interpretation. The next is 74328, which is nothing but endoscopic catheterization of the biliary ductal system, radiological supervision and interpretation. The next CPT is 74329, which is nothing but endoscopic catheterization of pancreatic ductal system. The next is 74330, combined endoscopic catheterization of biliary and pancreatic ductal systems, radiological supervision and interpretation. The next is 74340, which is nothing but introduction of long gastrointestinal tube, including multiple fluoroscopies and images, radiological supervision and interpretation. 74355 is nothing but percutaneous placement of enterolysis tube, radiological supervision and interpretation. Now coming to next CPT, that is 74360, which is nothing but intraluminal dilation of strictures and or obstruction, radiological supervision and interpretation. The next is 74363, which is nothing but percutaneous transhepatic dilation of biliary duct stricture with or without placement of stent, radiological supervision and interpretation. Let us look at an example. The patient presents for screening CT colonography. What CPT is to be reported? The appropriate CPT is 74263, which is nothing but CT colonography screening, including image post processing. By this, we complete the gastrointestinal radiology course for GI tract. One more example. Patient presents for laparoscopic cholecystectomy. A dye was injected to perform an intraoperative cholangiogram. The surgeon who performs the procedure included a separate report with his interpretation of cholangiogram that indicated there was normal free flow into duodenum with no evidence of filling defects and no stones or strictures. What CPT codes are to be reported? First is laparoscopic cholecystectomy. And additionally, intraoperative cholangiogram is performed. So the appropriate CPT is first is 47563, cholecystectomy with the cholangiography. The next is additionally, the surgeon who performed the procedure included a separate report with his interpretation of cholangiogram. 74300, cholangiography and or pancreatography, intraoperative radiological supervision and interpretation, because he has interpreted the cholangiogram and that is an intraoperative procedure. This CPT is given 74300, and additionally 26 modifier is appended to indicate the professional component. Now coming to diagnostic radiology CPTs for urinary tract. The first CPT is 74400, urography or pylography. Pylography is nothing but X-ray of urinary tract. Pylography is the procedure of radiological examination of urinary tract. Pylogram is the X-ray of urinary tract. So 74400 is nothing but urography or pylography, intravenous with or without KUB, with or without tomography. The next is 74410, urography infusion, drip technique and or bolus technique. The next is 74415, urography, infusion, drip technique or bolus technique with nephrotomography. The next is 74420, urography, retrograde with or without KUB. The next is 74425, urography antegrade radiological supervision and interpretation. The next is 74430, cystography. Cystogram is nothing but X-ray of urinary bladder. Cystography, minimum of 3 views, radiological supervision and interpretation. The next is 74440, vasography. Vasogram is nothing but X-ray of vas difference. Vasography, vesiculography or epidermography, radiological supervision and interpretation. The next is 74445, corpora cavernosography, radiological supervision and interpretation. The next CPT is 74450, urethrocystography, retrograde, radiological supervision and interpretation. The next is 74455, urethrocystography, voiding, radiological supervision and interpretation. The next is 74470, radiological examination, renal cyst study, translumbar, contrast visualization, radiological supervision and interpretation. The next is 74485, dilation of ureter or urethra, radiological supervision and interpretation. Now let us discuss an example. A patient with hydronephrosis is having percutaneous nephrostogram to rule out left renal obstruction. The patient was placed prone on X-ray table in which a contrast medium is introduced through existing nephrostomy tube to renal pelvis. Contrast flowed from right renal pelvis down the ureter into bladder. That is forward movement, where a Foley catheter was positioned. Pressure measurements were obtained and nephrostogram showed no obstruction or abnormalities in the urinary tract. What CPT should be reported? The appropriate CPT is 74425. Urography antegrade. Antegrade is nothing but forward moving. That is, the contrast dye is flowing from pelvis down the ureter into the bladder. That is forward movement. Hence, antegrade radiological supervision and interpretation. Additionally, 26 modifier is appended to indicate the professional component. Coming to the CPTs of diagnostic radiology, gynecological and obstetrical. The first CPT is 74710. Pelvimetry with or without placental localization. The next is 74712. Magnetic resonance imaging, fetal, including placental and maternal pelvic imaging when performed single or first gestation. The next is add-on code plus 74713. MRI, fetal, including placental and maternal pelvic imaging performed for each additional gestation. The next is 74740. Hysterosalpingography. Hysterosalpingogram is nothing but hysterosalpingography is nothing but X-ray procedure used to view inside uterus and fallopian tube. Hystero means uterus and salpingo means fallopian tubes. So 74740 is hysterosalpingography, radiological supervision and interpretation. The next CPT is 74742. Transcervical catheterization of fallopian tube, radiological supervision and interpretation. The next is 74775. Perineogram, vaginogram for sex determination and extent of anomalies. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.